I'm Heather Healy reporting in your neighborhood of Waco. I'm at Baylor Scott and White in Waco, and we're talking about Generation Z. Where do they get their medical advice? And guess what? It's not always from doctors. Say after you graduate, knock on wood, something's a little off. Do we go to Dr. Google or do we go to friends? What do we do?
I feel like I first talk to the people around me. I feel like I'm surrounded by a lot of people in the medical field, and then I go to Google, and then what Google says, I go to the doctor.
When it comes to going to the doctor, what is your protocol?
Definitely call my mom first,
Okay.
and then ask my friends, and then doctor kind of last resort.
Generation Z, or Gen Zers for short, start down different avenues before heading straight to a medical professional.
Yeah, I'll if I need a doctor, I'm going to look something up before I go to the doctor for sure.
38% are heading to social media for a diagnosis first. But is that really the right move to make?
It can be very dangerous. There's a pretty wide spectrum of what can occur after interacting with social media or just general online searches and queries to try to solve your problems.
Nurse practitioner Trevin Rube is with Heart of Texas Primary Care in Waco. He has 15 years of experience and says he's seeing more and more doctors taking a back seat.
It does feel that I have patients coming to me when they do come into the office mentioning these online search endeavors that they've undertaken prior to coming in at an increasing rate, but I have no data to be able to say that it absolutely is happening more often, but it certainly feels like it is.
And it's evolving in a big way. Dr. Melanie Raful with Baylor Scott and White has helped create a way to decide if you need to go to a doctor or not and where to go through the digital space.
It's here to kind of get some information. It's not here to diagnose you. So what our app does, if you download My BSW Health and you look under Get Care Now and you tick on Help Me Decide, you can start having a conversation. The first leg of this conversation is geared towards what are you experiencing? What are your symptoms? And you're having that conversation with an AI chatbot. It's able to say, well, I think you should be seen virtually. I think you should be seen in an urgent care. It's directing you to a venue. It's not diagnosing you, but it's trying to get you seen as quickly and as cost effectively as possible to get you diagnosed.
If your symptoms are a little more complicated, then you can actually speak to a nurse through the app. That's the beauty of it. They're trying to make it as cost efficient as possible. Reporting here in Waco, I'm Heather Healy.